Good evening, everyone. Thank you for joining us. We're going to try to be respectful of your time and our time this evening, so we will start right on time. It is 7 o'clock. I'd like to thank everyone for joining us and taking the time out of your evening. We have a wonderful program or a community conversation planned for this evening, and we're glad that each of you will be able to join us. I'd like to certainly thank those of our speakers who have been able to join us this evening. I would also like to just call out, and I hope he doesn't mind, David Blair, who has joined us. David, we're especially thankful because he is our co-sponsor for our Interfaith Works breakfast, a virtual caring breakfast, which is planned for in about 2 weeks. And we'll have a word about that towards the end of the program. But I'm really grateful that each of you have joined. This is a really important conversation about the distribution and equity around the COVID-19 vaccination. We know the data, and if you don't know, you will hear a little bit more about it this evening. So without further ado, I will turn it back over to our host, Rosetta Robinson, and I believe we have a short video to share with you now. Thanks again for joining.
Welcome everyone again, and we are so delighted that you can join us for our part 2 of the vaccine and the vulnerable. And so what we're going to do is begin with a video that features our staff getting their vaccine. So we're ready to show that.
Yes, I got vaccinated.
Yeah, I got vaccinated back in the middle of January. I have been vaccinated.
Yes, I did get a vaccine.
Yes, I did get vaccinated.
Sound cliche, but I believe in the science. I believe in a higher calling, but I also believe that it's been tested, and in order to get this thing under control, we need to get vaccinated.
I think that it's the only way that we can really move forward as a society.
I want to do something to help this sickness that's going on. I want to be positive about it, and I want to do my part to help somebody, not harm them.
For my peace of mind and for my health.
To protect my family members since I am coming into work on site. And I also got it for the Interfaith Works team that I support. It's so important for me to be able to be here.
I work 2 jobs, and also I have grandkids and I have kids that I would like to see a little bit more. And I just wanted to do my part in society as well.
Only soreness in the arm for maybe 24 hours.
Nope, my arm hurt a little, but I'll say that I've gotten the flu vaccine before and my arm hurt worse then.
The only side effects I have was some pain in my upper arm, and it was for 2 days, but by the 3rd day it was gone.
No, other than a sore shoulder, everything was fine.
No, I did not get any side effects except some soreness on the side where the vaccine was given to me.
We are hoping that all of our staff will be vaccinated so that we can all be safer and healthier together.
Thank you, Matt. And Matt is our communications manager, and he's going to help to field some of the questions when we get to the part of opening up a discussion to our audience. Thanks again for being present today. We have a wonderful team of presenters, and our schedule this evening will include 3 parts in a sense. The first part would be presentations from government and medical staff and personnel and authorities. And they will give us that perspective of what's the latest on the COVID virus as well as the vaccinations. You know, we're concerned about vaccine equity. And so we'll be asking them questions with regard to that. And we know that some of you who have joined us have questions as well concerning that very topic. Then our second section, our second panel of speakers are going to provide the community perspectives. So we're very pleased that we have with us representatives from the most impacted communities. And those communities are the African-American, Asian, Hispanic community. And then after that, we're going to have an open discussion, which will be led by our CEO around this issue of vaccine equity. And he will share this a little bit about an advocacy campaign. And when we emailed some of you, you may know about it. And if you don't, we know that you'll be inspired to participate once we get to that part. So shall we just dive right in and begin? Now, we had anticipated starting with our government panel, which would have included Congressman Jamie Raskin, Dr. Crow, and as well as Dr. Kelly, who is a physician that is working with iWorks in helping with some of our vaccinations and care for our homeless population. So Mr. Raskin has joined us, and we are pleased to know that he is here, and also that Dr. Kroll is here. I don't need to tell you a whole lot about Mr. Raskin. And Mr. Raskin, if I missed something that you think is valuable, maybe something I didn't know about, you can jump in. But I want to say it this way.
Thank you. Okay.
Yes.
But let's say, I mean, we want to use the time on COVID-19, so please, like, nothing too protracted. Okay, I'm among friends.
So if I say welcome, Congressman Jamie, we all have voted for you, well, most of us, and we appreciate the work you're doing. So thank you for joining us this evening to be able to give us a briefing, particularly on the American Rescue Plan and particularly these issues of vaccination and the funds and support around COVID-19. Thank you.
Well, thank you so much. I'm delighted to be with everybody. And yeah, so my job is to give the most macro sense of what's going on nationally so people understand that the American Rescue Plan is making possible meetings like this and strategies like this all over the country by infusing local public health operations with a lot more resources, a lot more staff, and a lot more money. So let me just give you that, 10,000 feet bird's eye view of what's going on. And so everybody can also understand that the Biden-Harris administration has been fighting to fill the pipelines of money, resources, medicine, and so on, so we can get the shots in arms and people back in work and the kids back in school safely, and so on. So the American Rescue Plan, is a $1.9 trillion plan. $20 billion go to our first coordinated nationwide strategic vaccine program to make sure that everybody gets vaccinated and that happens quickly as possible, that it happens equitably, and we're addressing communities that have been under-resourced in terms of public health. To make all this happen, the plan is putting $7.5 billion into FEMA to establish community vaccination sites and mobile vaccine units to travel around communities, especially in rural areas. $7.5 billion for the CDC to prepare, distribute, administer, and track COVID-19 vaccines in our communities. More than $5 billion going to BARDA, the Biomedical Advanced Research and Development Authority, to support further research, development, production, and acquisition of vaccines to get out so that we have all the vaccine that we need in different places, but we've got different makers now. So coordinating the mixture of different the mixture of different vaccines in different parts of the country. $1 billion for the CDC to undertake a vaccine awareness and engagement campaign to overcome myths and propaganda that were actually put out in the last administration about vaccines, and then $51 billion to expand testing and contact tracing and mitigation across the country, because as we're working to get everybody vaccinated, we know this is still going to be another several months before everybody's vaccinated. We've got to make sure that everybody is, maintaining the proper mask and social distancing protocols, and that we're doing the relevant testing and contact tracing. I should tell you that the administration just this morning made several announcements about how they're putting funds from the plan to work for the most vulnerable communities of color and low-income communities across the country. For starters, $10 billion is going to bolstering vaccine access for the most vulnerable communities. $6 billion is going to community health centers, and more than 60% of that money will go to predominantly African-American, Hispanic, Asian American, and Native American communities. In Maryland, 17 health centers will get funding to assist with vaccine distribution efforts and community outreach. 2 of the health centers receiving awards are based out of Montgomery County. I checked this morning, CCI and Mobile Med are going to be getting some of that money. CCI, Community Clinic Inc. in Silver Spring, has already been active in distributing vaccine to our most vulnerable residents through its participation in the Federal Health Center COVID-19 vaccine program, and they are also going to be getting more money as well. The administration also announced today $3 billion in federal funding will be invested in local efforts to increase vaccine intake and to address hesitancy in vulnerable communities. And finally, the administration is working to launch a program to give shots at dialysis clinics, so people who are getting dialysis don't have to go and make a special trip to do COVID-19, but bringing the vaccine directly to them. So, as people have probably heard, all Americans are expected to be eligible for vaccine by May 1. That doesn't mean everybody will be vaccinated by then, of course, but people will be eligible by then. And we know that we're working to make sure all of this gets done early in the summer, so that everybody will have had 2 shots or 1 shot, as the case may be. And of course, all of this is just part of a general plan that we've got in the American Rescue legislation that includes, as you know, the $1,400 stimulus checks, the child tax credit, dramatically expanded the $300 per week unemployment benefit, which will go until September. Now, $37.5 billion I worked on this in rental assistance, including $5 billion for emergency vouchers. So there is other money there to help people recover from the crisis that has accompanied COVID-19. So I'm going to stay on for as long as I can to my next thing to hear about how all of this is traveling through the different pipelines and making an impact locally. So thank you, Rosetta, so much for having me. And just so everybody knows, of course, you know how to reach me. My door is always open, and anything I can do to help, that's what we're there for.
Thank you so much. And I just wanted to let you know and everyone know that we're going to, we've talked about having a format of hearing the government and the medical perspective first, and then we're going to hear from the community folks. So we're going to move right now to Dr. Kroll, and then following Dr. Kroll will be Dr. Kelly. And Dr. Kroll, everyone knows, is the director of our Health and Human Services Department. And his background is clinical psychology. And we do know that this has been a stressful time for everyone around COVID and in so many other ways. And then after Dr. Kroll, Dr. Kelly will just share a little bit more about from her practice, as well as helping our clients who are homeless with the vaccines, and any update that she could give us around the vaccination process right now. So Dr. Kroll.
So good evening, Dr. Robinson. Let me start by saying thank you. Heartfelt hello to Congressman Raskin again. Thank you for all that you have been doing this past year at the state, and all I know you will be doing this year to keep this, to help us in this recovery process. Very much appreciate the work and the effort.
Thank you, forward to, Doctor.
So we would not be having this conversation tonight if folks here weren't already aware of the numbers and the issues around equity and inequity. But I'm going to talk a little bit about that, but I'm going to start with the bottom line up front, and that is that vaccine is here and more is coming. This has been a steady process of gradually ramping things up. It has been confusing and chaotic. In the first half of this year, first half of this pandemic was incredibly chaotic, with a lot of misinformation and disinformation about the vaccine and what the cures were and how serious it was. Fortunately, with the turn of the year and a new administration and a new Congress, we began to get really good coherent messaging and really concerted effort to try to bring more vaccine to us in the states and in the county. We have been working to try to resolve any of the ongoing challenges of disparate and separate systems and resolve a lot of the confusion that I know people have had about what's the state system and how do you get into the system and how do you register and how do you get a vaccine and what's the holdup. The bottom line for us before I talk about vaccine is to say two things. One is that the risk for us is still high. We have vaccine and we have seen some fall off in the number of people who are getting tested on a regular basis. We need to make sure that we're keeping folks tested and folks are staying safe. This vaccine is going to take time to arrive and time to get into everybody's veins and enough of us to give us some immunity as a society and as a community. We're also seeing new variants of the coronavirus show up and beginning to potentially threaten us with another spike if we're not very careful around this. So it is important for us to continue to get tested and continue to stay safe. Our numbers right now are at, as of a 7-day average for this day was 11.3 cases per 100,000, which is pretty close to where we were back in July of 2020 when we were coming off of that first wave and that second wave, and we thought we were settling out of this. And the virus proved to be opportunistic and jumped on us again and really hurt us in this second wave. And really need to make sure we don't have that happen to us again. We have been in the county since very early on in this process focused on this issue of equity. And vaccine equity for us is a special case of healthcare equity. And when we look at healthcare disparities and equity issues in this country and in Montgomery County, we know that this runs along race and ethnicity lines and along poverty lines. And this virus has followed suit. It has attacked communities that have been the poorest, the least able to protect themselves, the ones who had to stay out and continue to work, the folks who were suffering from deprivation of resources in terms of rent, in terms of food, and in terms of just means of supporting themselves. So they kept working because they had to, and because their healthcare status and their health was poor and challenged to begin with. And that has been part and parcel of what we've been wrestling with. We've gone through a process back and forth with the state and our own systems to try to create strategies that ensure that access to the vaccine was equitable. And we've seen the data, so we know what this looked like at the outset of this process, and that people who had means and time on their hands could go as far away as Eastern Shore to get a vaccine. But folks who couldn't travel, who were stuck at home, who didn't have the ability to take a day off or have family members who could take a day off. Folks who had a digital divide that is also along the lines of poverty and race and ethnicity. Folks who had linguistic challenges and couldn't access websites and pages that were in another language were challenged and are still challenged, quite frankly, by this. We have worked, folks, we may talk about this a little bit later. We created an equity framework. And we created a couple of things. We stood up a pre-registration process to slow this down so that doses weren't just first come, first serve, but to make sure that they were distributed in a more equitable framework, that access to the doses were distributed in a more equitable way. So that Black and brown communities and communities where the virus was hitting hardest were the places that we were concentrating on getting doses, to getting people opportunity to get vaccinated. it has paid off. I was looking at some of the data on this today, and it is showing that there is some evidence that we are beginning to catch up and reach some parity in our older, especially in our 65 and above communities. We are a long ways from done. As we move further down in age and broader and out to other groups, to grocery store workers and to restaurant workers, we're still going to find ourselves needing to be careful and be mindful to make sure that folks who have the worst needs, have the greatest needs, are being vaccinated. There's some synergy that is developing. We now have, after a lot of advocacy and a lot of push and a lot of support from a lot of the folks on this call and that I'm looking at on the screen, we have a mass vaccination site that is being stood up in partnership with the county, with the state, with Holy Cross Hospital, with Montgomery College in Germantown, in the Germantown campus. That's due to go live. The state version is due to go live on the 5th of April. We'll be standing up a county site. The county site there, our part of that will start a few days earlier. But it is a sign that we have finally turned a curve and are beginning to collaborate and do some partnership. Mobile Med is doing vaccines and is a partner. We have the Minority Health Initiatives, the CCACC, the Saludi Bienestar, and the African American Health Program are all lining up to help us do vaccinations. The county doses have been limited, but we have, as we've gotten more, we're working to stand up and work with providers so that we can push out more doses and provide them and share them with folks who can get into communities that we may not be able to reach, who speak the languages of those communities, who look like those communities, who have the trust of those communities, and can get in there and do that and do vaccinations so that we multiply our capacity to get out there. So those partnerships are alive and growing. We don't have doses yet, all the doses that we want yet to put out, but we are working with folks so that when we do, we have partners in place that we can say, here, take these doses and run with them. And beyond that, the state, after many weeks of sort of nudging and encouraging, began to stand up its own pre-registration process and began to stand up its own equity plan. And so we looked at their equity plan and we've been talking with them, and we've now begun to build some inroads with them so that as they roll out their equity process, we can partner and say to them, here are the places where we need somebody to stand up a vaccination site the most. So those partnerships are coming together all in the same time. We're building towards, the governor has said April 27th is the date that we will that we will open up to ages 16 and above for vaccination. And by then, I think we will have partnerships in place to make sure that as doses come in, we can get them out the door to folks and get them vaccinated. There's still a lot of challenges with this. There's still a lot of coordination that needs to happen and a lot of work that needs to go on in the next month and in the next coming months. I think we are going to get out of this by doing this together and doing this partnership together and by staying safe. Beyond this pandemic, and this is the piece of me, the psychologist in me now has to talk about what we're going to be left with. People who've gone suffering for food, people who are facing potential eviction or afraid of eviction, the trauma of having lost family members, multiple family members, and not being able to mourn them or grieve with family in the way that we traditionally would, all of that is going to be left with us. And that is a trauma, that is a series of traumas and a series of the work ahead of us is about the recovery. Long after the state of emergency for the pandemic has been declared as over, and we are past the bulk of the virus, we're going to be dealing with this. We're going to see people in the homeless system who are going to come into the homeless system, and we're going to have to figure out how we protect them and how we get them through that. And to Congressman Raskin's point earlier about rental assistance, we're going to have to figure out how we stop some folks from coming into the system by supporting them and protecting them from being evicted, and to give them resources to stay afloat until the economy picks back up and they can get back to work.
That's
important. And then I think the last thing that is coming down the pike, and I will stop, I promise.
Thank you.
Is that we are aware that folks are coming across the border, that we have immigrants coming across the border, and we have young children who are unaccompanied minors, and some of those folks are going to end up here in Montgomery County. And we're now gearing up and preparing to figure out how we support them and prepare for their arrival and help them to deal with the trauma that they have faced as they become a part of our community and join and add to the culture that is Montgomery County. So I will stop there and we'll come back to that. Okay, thank you, Dr. Robinson.
Thank you. Dr. Kelly, well, you certainly are on the front lines with us, with our clients who are homeless. So Dr. Kelly, please share any perspective that you would want to at this time.
Well, thank you all for having me here. Thank you, Congressman Raskin, for coming on. I was told that you gave my son your first business card as a new congressman in the Long Work Tunnel when he was going to see Congressman John Lewis. So my son has autism, so my son and my husband have not forgotten that. So thank you for that, but also thank you for all that you're doing to help people during this time that are dealing with hardship. So
thank you so much. Send him my love, will you?
I will. So the first thing I want to just touch on is, and these are things we know, that people experiencing homelessness are dying from the virus or contracting the virus at a higher rate. Amongst the general population, it's about 231 persons per 100,000 that are dying versus single adults and mostly males, 413 among our persons experiencing homelessness. So we do know that those populations are being affected more. And also because of those who, we have data that shows that they share a room or they share a room with more people, that there's more of a risk that they're contracting the virus and then having complications. So some of the things I was asked to kind of comment on specifically have to do with the vaccinations themselves. And some of it, what we're seeing is some hesitancy among patients and among staff as well on getting vaccinated. So I do primary care for the shelters in Montgomery County, but I also have a private practice where I see just general patients from a range, about 20% Medicaid, 20% Medicare, and the rest are commercial patients. And there is that hesitancy. So especially amongst my Black and Brown patients of previous fears of distrust. And so a big part of what I do on a regular basis is actually try to give them correct information. And I think that's a part of what my practice is also doing with the county. We did one round of education with the patients where we went through and talked about the virus. In addition to staff, talked about the vaccine and tried to answer questions. But we're going to be doing that again and try to do that consistently, hopefully once a month. And we'll be starting that with IW as well, starting in April. To try to, be a trusted face to them. We do feel like they trust us and they'll come to us and ask us questions. So we do want to help in that and getting more people vaccinated, because we do recognize that they're the ones who are going to be suffering from this, and when we're talking about equity, it's inequitable in the amount of people that are experiencing homeless that are Black and Brown. So, they're going to be impacted in all those ways. As you know, now there's 3 vaccines that are approved for emergency use, Pfizer, Moderna, and the Johnson & Johnson. One of the things that we talk about is the effectiveness of the vaccine. So the Pfizer vaccine is about 95% effective at preventing serious illness, 94% for the Moderna. The Johnson & Johnson, so the data was about 66% at preventing infection, but they've been pushing that it's about 85% effective at preventing severe illness and 100% effective in preventing death. The importance of the Johnson & Johnson for our specific population is that it's a 1 dose. So it's very hard to get our homeless patients to come back and to be responsible to come and get a second dose. So having something that's 1 dose that we can give them and not have to try to track them down again, understanding what homelessness is in totality is important. And the Johnson & Johnson is a vector vaccine, which means that it's pieces of the virus that are used in the vaccine and injected. We're currently in 1C, and I think we were talking about this, they're going to 2A, I think, and then to 2B. We've currently, as of March 15th, have administered 1.9 million doses of vaccine in Maryland. And Dr. Crowell may have more up-to-date information than that. But most of the people who have gotten the vaccine, which is in line with our vaccination plan, are those that are over 60 years old. So going down to some of the questions that I was asked to address. So do I have to wear a mask when I receive the vaccine? So the answer overall is yes. Now, the CDC did put out some recent guidelines that say that if you are vaccinated and you're with other people who are already vaccinated, and when we say vaccinated, we mean if you're getting Moderna or Pfizer, that you've gotten both doses and it's 2 weeks past, because you need 2 weeks in order to develop the antibodies and be at the most effective place, then you can be in a room with them unmasked and not social distancing. But overall, except for in those situations, and in situations if you are vaccinated and you're in a room with a single family of unvaccinated persons, then that you can do that. But in all other instances, you should continue to wear your face mask, continue to social distance, continue to do hand washing, all the things that we've been saying this whole time. If you are vaccinated and you do begin to have COVID symptoms, you do need to be tested. So if you already had COVID and have recovered, do you still need to get vaccinated? The answer is yes. It is unlikely you will be reinfected within 90 days of having COVID, but you still should be vaccinated. So overwhelmingly, what I found in my personal practice and in the homeless shelters and working with specialists is that the answer to should you get vaccinated is overwhelmingly yes. There's a very small minority of people that we would argue against them getting vaccinated. I have seen a few allergic reactions to the vaccine, but also making sure that patients understand the difference between a side effect and an actual allergic reaction. So just having a fast heart rate is not an allergic reaction, it is a side effect, versus hives, throat closure, anaphylaxis. Those are issues with an actual allergy, and they should also be encouraged to report those to the appropriate people to make sure that they have that information. What is the COVID-19 variant, and does the vaccine protect against it? Viruses constantly changing through mutation, and new variants of the vaccine are expected to occur. Scientists are confident that currently authorized vaccines are effective against the virus, but some studies are now being conducted to determine the best way to maintain protection against COVID-19 illness. So the answer is we don't know, and we're going to keep finding out. And one question some people ask is, when can I stop wearing a mask? We just don't know. And I think we have to be patient and give it some time, but continue to do the things we're doing so that we can decrease the infections, decrease the deaths, and especially like we've been talking about among those populations that already have healthcare inequity and are disproportionately dying or having significant complications from the virus. I can't speak on children. I don't see children in my practice, but there are studies currently underway to try to see if children would benefit from any of the current vaccines, but we just don't know yet when that's going to be completed. It's always, we always tread lightly when it comes to pregnant women and children, so we just don't know at this point. But hopefully in the near future, we will have a vaccine approved for people under the age of 16. And then the last thing I'll talk about is just the percentage of population needed to get vaccinated for herd immunity. Again, the answers we don't know. We hope, and with Dr. Fauci, I think we said between 75 and 85% of the population would need to be vaccinated, but we will just do our best to try to get as many people as we can to agree to get vaccinated. And I always tell people the difference between just having people do herd immunity naturally is that we don't want to see another 500,000 plus people die from this virus. So a lot of what we're doing is doing our part to save other lives. So does anybody have any questions for me?
Well, thank you, Dr. Kelly. And Dr. Kroll is still here. And so we are going to allow for some questions. I know that Matt, who was going to sort of share those with us, because we have some folks on the phone and we want to make sure that they hear that. Do we have any questions, Matt, or that we need to ask? No questions at this moment?
Nope.
All right. Well, then what we have is such a great panel that all of your questions have been answered already. But I did hear something, Dr. Kelly, and also Dr. Cole, I'm going to ask you this. I did hear something about the fact that down the road, are we concerned that people would need to get a booster shot down the road?
And I think that's a possibility. I mean, I think if you look at it from the standpoint of the variants and the mutations, just like we do with the flu shot, we do different strains every year, and the flu vaccine changes. So I would not be surprised that that will be the thing to come in the future, because we already are seeing variants of it coming up now. So I think, you know, as we continue in the science of it and follow what we know about vaccinations and about what we have to do from year to year, I think that we will see boosters or recurrent vaccinations annually.
Thank you.
I think that's right. I would add to that the challenge, the nice thing, the important fact is that because researchers know so much about the coronavirus, and because they've been working on this vaccine and not the family of coronaviruses, of which the flu is typically part of, they will also be able to build adaptations and boosters that are keeping tabs and working on the variants. So they will be working on that throughout this process and learning more every day about those variances.
Thank you, Dr. Kroll. So we're going to now, with no more questions, we're going to move to our second panel of our community representatives. And I've already mentioned their names a little earlier. We are really pleased that we have Grace Sullivan, she's on our board and has been a community activist with our Hispanic community. And Yi Shen has worked he's the liaison, Asian liaison for the county with the Office of Community Partnerships. He has done a lot of work in his past with in the government, working with at the state level, Governor O'Malley, as well as with Senator Van Hollen. And so we are pleased that he is able to bring some of those skills to his work in the county. We also will then hear from Arlie Wallace, and Arlie Wallace is the program manager for the African American Health Program, and she has had significant experience dealing with health and health disparities, working for the state of Maryland and the federal government, and we appreciate her knowledge as well. And then we have Monica Baltimore, who's going to be representing the National Council of Negro Women. She too has had a background in health and working for the government. And so all of them bring not only the grassroots experience, but some of the technical experience around this issue of health and equity for the communities that are most impacted. We're going to begin with Grace, and then we'll be followed by Yi Shen, and then Arlie Wallace with our African American Health Program, and then finally with Monica Baltimore with the National Council of Negro Women. All right, Grace.
Yes, good evening. Thank you so much, Rosetta, for having me. Let me start by saying it's such a pleasure to be in such a distinguished panel, and it's also such an honor to serve on the board of directors of Interfaith Works. My name is Grace Rivera Open. For those of you who don't know me, I'm also the director and the founder of the County Consolidation Hub. And I want to do a special shout out to Dr. Crowell for being such a great supporter, not just of the Germantown Hub, but also of the many other hubs that we were able to establish throughout the county. And food sustainability has also a lot to do with the needs that we're seeing in, with the populations that we're seeing with the need with vaccination. Very quickly, we started the hub exactly to the day. Today is our 1-year anniversary. And we started by helping 20 families at the trailer park home in Germantown on Middlebrook. So we are actually really fortunate that we're still able to provide the services to this community. And we also started testing with our partners, Care for Your Health. They have been our partners since last April. And with Dr. Izquierdo's team and also with folks from HHS, we did a pilot at the trailer park home. And we were actually then able to test these folks, and we are testing them now since then every other week. We go to other different apartment complexes, and we are serving about 1,200 families weekly that we are actually providing services to, and food sustainability. So I don't have to tell you that back in the summer, we saw such a surge of positive tests of COVID in our communities of color. And from there was this movement with the Latino Health Initiative to create the Salud and Bienestar program, which is health and wellness in English. And we have ever since been working as a group. Then our brothers and sisters from the African American Health Program and others follow, which is wonderful, because we knew that our communities of color were the most affected by this unforgiving virus. And so now we are at a point where we are seeing the great need of getting our folks vaccinated. And I don't have to tell you the challenges that many of our families are having, the elderly and so on, to be able to even pre-register. Some of our folks don't have Wi-Fi. And it's just almost, for some of these families, almost impossible to do the pre-registration online. So with Salud and Bienestar, we actually have a phone number in Spanish. I'd be happy to give it. And they can also call the county consolidation hub to be able to get more information, or to actually be able to sign up, and we will be able to help them with the vaccination. But I have to tell you, in our community, it was such a devastating wave of seeing so many people who were getting COVID, but who were dying. I will talk to my other friends, some of my white friends, and they will say, I don't know anybody who has passed away from COVID. I heard about somebody, and then in our community started getting closer, and it just became, somebody at church, and then it became, somebody that, my uncle knew, and then it became my best friend. And so they became just very, very real to those of us in the Latino community. So with all those challenges that we are seeing of people sign up, we decided that it was really important for us to be able to help these folks. I'm so glad that Congressman Raskin talked about the folks with dialysis. We actually vaccinated quite a few folks with who are on dialysis. And with Care for Your Health, God bless them, Dr. Izquierdo actually went to people's homes to be able to vaccinate those folks who were on dialysis. So those folks, we had quite a few who were over 80 and that should be venturing out. So we are here to work collectively, to work with our partners, to work with HHS, and to work with our brothers and sisters. We're actually looking at putting together with the Korean Society of Maryland, where we want to actually come together and have a vaccination clinic for our grandparents, our abuelitos. So we're working on that project as well, but we look forward to working with anybody in order to be vaccinating our frontline workers and those who are truly the most vulnerable in our community, in order for all of us to go back to at least to some normalcy in the future. Thank you, Rosetta.
Thank you so much, Grace. That is wonderful, those collaborations. Yishan?
Hi, good evening, everyone. My name is Yishan. I'm the Asian liaison for Montgomery County. I work out of the Office of Community Partnership. Let me first give you a small background, a little bit of background on our office. The Office Community Partnerships work with the various communities in Montgomery County. So for example, I'm the Asian liaison. We also have a African liaison, African American liaison, a Latino liaison, LGBTQ liaison, a Caribbean liaison, and a faith advisory liaison. I think I might be missing one.
Middle East?
Middle Eastern liaison, I apologize, yes. So our task is to be the bridge between the community and government agencies. And our office has been behind the scenes working as an essential office this entire time since COVID-19 started. Excuse me. We've been working on multicultural and multilingual outreach to the communities. We have translated essential websites, for example, the COVID-19 website or the vaccine website, into the top 8 spoken languages in the county, because I'm not sure if everybody knows this, but Google Translate don't actually get the job done. Sometimes they have completely different translations that what you put in. So if we put in, please wear your mask outdoors, they might spit back, you don't need to wear a mask outdoors in Chinese, and that's not what we want to translate. So let me give you a little bit of statistics about the Asian community. There's, according to the 2010 census, because we don't have the 2020 yet, there's about 15 to 16, well, the Asian community is about 15 to 16% of the total population. So you're looking at about 150,000 to 160,000 in Montgomery County. There's about 83% of the Asian population are foreign born. So you're looking at a huge population that's the first generation. There may be more because over the last 10 years, the Asian population was the second fastest growing population in Montgomery County at 600 and I want to say 50% growth in the last 10 years. Second only to the Latino population, which is at 800 something percent growth. So out of the total population, there's about 33% who can speak English less than very well. So we obviously have a issue with getting our information out to the population because of language barriers. And then for our community, out of the 65,288 total cases of COVID infection, there's only been about 2,443 cases where Asians were infected. So that's about a 3.7% for the total number of cases. And there were about 143 deaths in the Asian community in Montgomery County. All the data can be accessed on the county website. I'll put the link in the chat. I think the reason that the number is fairly low for the Asian community is mask wearing is not seen as taboo or any kind of issue in the Asian community. It's kind of an accepted norm in a lot of the Asian countries due to pollution and also density of population. So people don't want to catch cold or pollen or want to get sneezed on. They all wear a mask. Most of the so our office also held community surveys on COVID vaccine to get community attitudes on the vaccine, and also held focus groups in different languages. And I've heard from a lot of people regarding the vaccine, and most of our community members in the Asian community want the vaccine. There's only about 8% that said they're not sure or they don't want it. And out of that, I think it's only 3% that said they don't want the vaccine. So the community's concern on the vaccine is they're concerned that the vaccines have not been tested on enough Asian people. They're concerned that there's some kind of biological differences where the vaccines can be fine for certain groups, but not fine for Asians. They're also concerned about the long-term side effects and the short-term side effects. They are concerned about the short turnaround time on the vaccines. Usually vaccines take about 15 to 30 years. And then this is like less than a year we have vaccines. So it's actually a miracle that we got them. And then also I've heard concerns from pregnant women who are concerned that vaccine can cause some kind of issue with their unborn children. So those are the main concerns that I've heard from the community when it comes to hesitancy in getting the vaccine. We do have other concerns will be from people who want the vaccine is number one, the biggest challenge is language access. A lot of our population are also seniors. They don't have access to computers or cell phones, modern cell phones. They have those flip phones, the older ones. And they don't know how to navigate the registration sites. They don't know when the state sent back instructions on, you have to schedule your shot, you have to follow these instructions to schedule your shot, and where do you go to get the vaccine. They don't have any idea, they can't read it. So we are fortunate because a lot of our nonprofits are stepping up to help our senior population register for vaccines, and also getting them the instructions on where they need to go and when they need to be there. And some some of the nonprofits also drive our senior population to the vaccine sites. And I think CCACC has worked out a deal with HHS where they can hold vaccine clinics for the senior population, specifically the ones who are 75 or older, because if the county couldn't reach them and if they're homebound, then CCACC will go ahead and do the vaccination because those seniors go to their senior care center anyways. So my concern regarding the issue and what we've been working on is we want to make sure that the community members know where to pre-register and how to pre-register or go get to a nonprofit that could help them pre-register. We want to make sure that the community are aware of the vaccine scams that's out in the community. And there are a couple, so I would urge everyone to go to the Office of Consumer Protection on their page. If you scroll down a little bit on your right-hand side, there's a box with all the scams in the county, and there are some opportunists out there trying to call people and ask them if they want to be registered for the vaccine, and just collecting or harvesting personal information, and we want to make sure the community is aware of that. And my other concern is to address any kind of conspiracy theories that's out there, because unfortunately, a lot of our population are getting their information from like WeChat, foreign postings from other countries, and a lot of other countries are putting fake news on these social media apps, where they're saying, COVID's going to kill you, or basically conspiracy theories. And the main reason for that is other countries don't want us to excel or get better, because the more we're quarantined and et cetera, the worse our economy gets and the stronger they get. So they keep pumping on all these fake news to our population here. And fortunately, like I said, it's only 3% that's hesitant in getting the vaccine. Most of the population want the vaccine. Some of the population have adopted a wait and see attitude because they want to see what kind of side effects the general population who get the vaccine are getting before they themselves get the vaccine. But it doesn't mean that they don't want it. They still want the vaccine. So what I've been doing in our office is we've been translating information about COVID-19 and the vaccine in the multiple languages in Montgomery County. For me, I distribute Korean, Chinese, and Vietnamese, the top 3 spoken Asian languages. I've hosted a vaccine conversation with the Asian community, and Dr. Crow was one of the panelists, and I have worked with nonprofits into getting the news and resources out to the community regarding vaccine and rental assistance or funds for small businesses. We've been going to food drives to we will be going to food drives to put registration documents into bags, and we'll also be eventually we'll be going to grocery stores as well to either get information to the population or help them pre-register if we're able to. And I'm also working with the Up County Citizen Group to distribute information and brainstorm and figure out how to get the information to the various neighborhoods in Up County. And I'm also part of the county's task force to get international grocery store, the essential workers, to get them priority in vaccination, because that's a tier, the state's tier 2B, I believe. So no, 2C. So we're working on that as well. And I just want to say that the community's been extremely helpful in regards to helping Montgomery County disseminate COVID-19 information. Sometimes when I send out a notice, they basically translate it and then just send it to their entire listserv. So we've formed kind of a symbiotic relationship over the last year because of COVID-19, and if there's anybody
Thank you.
Oh,
yes.
yeah. And if there's anybody who needs help regarding the Asian community, please feel free to reach out to me. I'll put my information to the chat box.
Thank you so much. It's very, very informative. We're going to, I know our CEO has some wonderful news to share about our advocacy campaign. And so we have about 15 more minutes if we're going to try to end on time. And so Arlie Wallace and followed by Arlie Wallace, and I already have told you a little bit about her. Then Monica Baltimore will jump right in after Arlie. Thank you, Arlie.
Thank you, and good evening, everyone. Congressman Raskin, thank you for your support on the Hill, for all the work that you and the other leaders are doing in DC. I do want to thank Dr. Kroll for his leadership for HHS. Dr. Robinson, thank you for extending this invitation out to us to participate. I am the program manager, and I want to give you a little bit about what was happening in the Black community, which is extremely diverse when it comes to some of our foreign-born Black residents, as well as those first generations that we have here as well. Because of that diversity, we are looking at the different variation between the African immigrants, the Caribbeans, as well as the African-American population. All of those are very distinct and different groups, and some of their needs vary. The Black African-American group is the oldest Black population in Montgomery County. That is Black. That group has suffered a great deal of health disparities for years. Therefore, when COVID-19 struck, it was extremely devastating for the Black community. We also dealt with the issues with our sisters and brothers of African and Caribbean descent because of lack of healthcare coverage, in which a lot of those communities do not have to this very day, which forced them to have limited access. So when we started looking at what was happening and knowing that there has been historically health disparities that has impacted the Black community in Montgomery County for decades, we knew that we had to do something within the African American Health Program. Therefore, we came up with a very strategic plan in trying to address those issues. First, by pulling together the Ethiopians as well as the Africans and the African American community-based serving group that we do have in Montgomery County, so they could work on us to start to get the information out in the community. We in turn knew, due to the lack of healthcare provider, that we had to try to get those who were in greater need, if they were tested COVID positive at any of our sites, connected to a medical home. Therefore, we created what is called our Black Physician Network, that we have tried to extend it out and bring those Black docs and others into the fold. And with our project, we are providing deductible services and some ongoing pay for those individuals to go into the doctor's office, as well as being able to support them with any type of prescription refill that they may need. It was also very devastating for the Black community because they are part of that front line, your grocery store. They are also part of those who are working in diverse issues that are very tough and cruel, such as some of your bus drivers. They also live in very dense neighborhoods where they are living in shared homes and apartments that are overcrowded. So we want to make sure that those persons who are still struggling to make their rent, we know that they're also the ones who are also suffering with not being able to get access because they can't afford to take off work because their jobs in which they have do not necessarily carry them a type of benefit. So we in turn was focusing on the food insecurity that we knew that the community would have. On top of that, it was so devastating that we were losing individuals that they did not have time to seek any form of mental health services. So within our project, we have mental health services being provided through some of our local partners, and we're connecting them through the services we can provide, as well as to others in the county. We deliberately targeted those Black serving community-based organizations, such as our churches. They are the ham in which most Black people trust and go to. So we was key to provide partnership and working in those communities with our Black leaders and our churches, as well as working with some of our Black Greek organizations so that we knew that they had the target audience and places that we could also pinpoint. Due to the substantial low income in which Blacks also reside in Montgomery County, we was able to partner with the Housing Opportunity Commission, where we put on a numerous types of COVID testing sites there. As we progressed along, we saw the need when the vaccine was coming on board. So we started at our vaccine site, actually pre-registering individuals who are definitely in those key priorities levels and tiers right now. But if there was other people who needed and wanted to be registered on site, the African American Health Program staff, along with the National Center for Children and Family Services, who was working with us, made and staff available who was on site to do it instantly. And we're verifying the information is being provided to everyone. We looked at a strategy and also having to work with those persons who would need ongoing care. So we have a component that is called our Nurses Navigator System, so that individuals who are definitely positive, we're working with not only just a positive individual, but their family, and bringing in food at the site, as well as follow up, where we would take food and deliver it to those who are under quarantine, because we did not want them going out in the general population, potentially infecting others. We knew that there was a number of people who was uninsured. So we was trying to get people connected through the navigation services so they could go and apply for any form of health coverage in which they are eligible for. And in the meantime, those who had health insurance coverage but did not have a doctor, we was directing them to that Black physician network. We are also looking at broadening our issues into apartment duplexes. So early on, well, midway, I should say, when COVID hit, the African American Health Program was also and had partnered with, and we will continue to do so, with the Montgomery County Housing Partnership. And those are those apartment duplexes where we know in the East County catchment area, we were able to successfully go out and set up sites and work with that partnership. And we're going to continue to build on that going forward. I do want to say that the Black community is faced with numerous barriers, not only for the COVID testing, and that included the fact that it was quite difficult for some Black communities who do not have, and this is really our aging community who are Black, who do not have internet in their home, nor do they have computers. Their telephones that they have are very limited and restricted. And then on top of that, you have the aging Blacks who are no longer feel that they have the mental wherewithal to really drive themselves to these places that they are unfamiliar with, that is out of their normal driving ranges. So we looked at, and they have some severe mobility issues. So what we was trying to do is make sure that as we came together, we was bringing the test site in those communities where we could assist. The African American Health Program, along with its partners, has been registering individuals for those appointments to go out and be tested, especially for the vaccination. We have taken that on. We have made a community type of arrangement with those that we know, that if we know an elderly person or persons who are unable to get to the vaccination site, we are making those arrangements with either church member, friends, or in some cases, just neighborhood individuals that we are going to, and we're doing the follow-up calls to all of those individuals that we know of that has reached out to us. Those who have gone through our chronic disease program that the African American Health Program has had historically, we've called all those and provided services, and even are reconnecting them as well to the different type of needs that we know that they may be in need of. And we just wanted to make sure that we make everyone aware that we've extended our relationship in building with the Office of Community Partnership. I've had a chance to meet not only with the director, but the African liaison, Caribbean liaison, as well as the African American liaison, and making sure that we're going to build on that relationship with the Office of Community Partnership to make sure that we do activities together with them, as well as trying to work on what we're calling our communications plan, so that we can try to have clear, precise messaging that we give out to our varying Black populations.
Thank you.
Thank you, Dr.
Thank you.
Robinson.
Yeah, this has all been so informative, and we know that we're not going to end at 8:15. We want to make sure that those of you who have questions can get them answered, and this sharing is so vital. I don't know how often we've had the African American, the Asian, and the Latino community, all three talking about, and there certainly are definite, clear connections and common concerns. History is different, but there's some very common concerns. So we're going to ask Monica to join us next. Monica from the National Council of Negro Women. Are you ready?
Yes. Happy Thursday to everyone.
Thank you.
Interfaith Works, for inviting the Potomac Valley Section National Council of Negro Women to participate in the Community Conversation Part 2, the Vaccine and the Vulnerable. The Potomac Valley Section's motto is "What We Do Matters." The National Chair and President of NCNW, Dr. Jonetta B. Cole, says, "You cannot fully understand your own life without knowing and thinking beyond your life, your own neighborhood, and even your own nation. In this case, your own community." We all have viewpoints and perceptions. Some we may agree with and others we may disagree. Most people's perceptions are their reality, and we may disagree with it, but I believe in respecting others' points of view. We all know the devastation that COVID-19 has caused our families, communities, the nation, the world, and even ourselves. COVID-19 brought out what many have been saying for decades. Racial and ethnic disparities are alive and well. We live in a system that historically accommodates one population while marginalizing others. I believe we can all agree that the rollout of getting people inoculated from the virus was not picture perfect. There is an increasing urgency to ensure that Black and African Americans in Montgomery County receive COVID vaccines as soon as possible. Health experts are increasingly concerned about the spread of the new variants to the predominant strain of the COVID-19 virus in the US. The longer people are unvaccinated, the higher the virus potential to spread, mutate, and cause further disease and death. Earlier this week, it was reported that Montgomery County registered an increase in COVID-19 cases and more deaths. It is in the best interest of Montgomery County and the state to accelerate the rate COVID-19 vaccines are provided to racial and ethnic minorities to reduce the spread of this virus. I want to thank the county and state officials for the crucial data collected and shared with the public. We agree that collecting data by race ethnicity should be encouraged at each stage of the process because it documents the extent to which populations are being reached by health programs and interventions. The potential misuse of race ethnicity data needs to be cautioned against because it is a major perception that race ethnicity data are being used to exclude minority populations from receiving COVID vaccines. Accordingly, Montgomery County health officials must assure the public that every effort is being made to ensure that all receive the COVID vaccine in a fair and equitable manner, regardless of race and ethnicity. Efforts to increase vaccine distribution in the county zip codes with high levels of minority populations but low vaccine rates could include using mobile vans, increase the recruitment of churches, civic organizations, and community centers. These and other non-traditional methods should be maximized to increase the number of vaccines administered in Montgomery County. Unless equitable distribution of vaccines is implemented countywide and more Black and brown people are significantly inoculated at a higher rate, the nightmare of COVID-19 will continue. And unfortunately, none of us will be free from it. Thank you.
Thank you so much. As I said, all of these presentations right now. I've been listening very carefully, and thank you all for sharing the concerns from the heart of your community. We want to just take a moment to see if there are any questions from anyone who's heard these presentations and might want to ask a question before we would move to one of the strategies that IW is launching to address this issue of vaccine equity. So there's time to do this right now. Who will be first?
I have one question. I have one question right now from Amanda Moskowitz. She is asking Dr. Kroll, what steps is the county taking to reduce the barrier to entry, and what can individuals do to help those in disadvantaged communities?
That is a great question. Just briefly, one of the things that we as I mentioned earlier, we created a pre-registration process to slow down the process and eliminate the first come, first serve problem that we were experiencing with the state. But we're also aware that there are linguistic and digital access barriers. So one of the things we've done is established partnerships with our community providers in the Office of Community Partnership to have community members sign people up and pre-register them and help them pre-register and help them to sign up for a vaccine when it is time. The other thing that we have done is we've reached out to the clergy, to the faith community, to engage them and getting the message out about vaccine and about vaccinations and about resources, and work with them to stand up vaccination sites. We just came off of doing a site with the Muslim Community Center this weekend, and we'll be going back with them again. We've taken vaccines to those locations where we could. The partnership with the minority health initiatives that we talked about is our other way of making sure that vaccines are delivered to those sites where they can, where we can to communities that are hard to reach, like our Middlebrook Gardens areas and other parts of East County. The other thing that we've done is we've launched and we're working on a home-based delivery process to be able to take vaccines to people's homes, because we know they can't get out to Grace Rivera's comment earlier today, that they have trouble getting out, so we need to take it to them. That's just some of the things that we're working on. The equity framework that I talked about in the pre-registration process is changing continuously. So we're constantly looking at the cases and the case rates to see where the virus is hitting us hardest, so that we can adjust where we're trying to deliver vaccines to. We expect that equity framework is going to shift, and if we have enough vaccines and enough people in the right places doing vaccination, we can go straight to sign up and get vaccinated very quickly and efficiently. There are already some models for that being in operation now, and some demonstration of our ability to do that. So as we get more people who are on site delivering vaccines in the right communities, they can go straight to signing people up, putting them in the system, and getting them vaccinated.
Any other questions or concerns at this moment? You know, I have a logistical question for you, Dr. Kroll, and it's for any establishment that is actually providing the vaccines. You know, we were all encouraged to sign up. Everyone, so many people have signed up, and thanks to the work of our CEO, which he may mention in a little bit, we were able to get many of our staff vaccinated, regardless of age. But the culture was just sign up for as many places as you can and just wait to be called. Well, one of the concerns that's being voiced is, what do you do to get off the list so that someone else can get on? So I want to know about that process.
So we announced the process yesterday that we had a system that stood up to allow people to fill out a form and say, take my name off the list. So that has been a long time coming. One of the interesting concerns.
Good.
So that is in place. One of the things that was a reality is that once you signed up for us, you weren't blocking someone else from getting on that list and being accessed. We might send you an invitation, but if you weren't responding to it, we were recognized, and we could check and see if you were vaccinated. We could take your name off that list and move on to the next person. So, but the unregistration process is now up, I'm happy to say.
Thank you. Thank you. Anyone else have a question before I recognize our CEO to talk about the advocacy for vaccine equity that we all are concerned about, and especially our communities that have been impacted most with the various concerns about how their community might be targeted or not served well. Any other question?
I have a question. This is Monica.
Yes.
I wanted to, if there's any type of, I don't know what the right word is, if you see something or something is not right, like for instance, what happened to someone, they had registered, and their appointment was scheduled, and then they received a cancellation. And so because of all they did to get the appointment, they went to the site where they were supposed to be vaccinated. And when they got there and asked the person, hey, I just received an email saying that my appointment is canceled. And he looked, he said, no, your appointment is not canceled. And so what do you do when you get those types of things? Who do you report to that, hey, this kind of stuff is going on?
So I think that there have been all kinds of situations like that, Ms. Baltimore, that we have seen, and that's a variation on one that I hadn't heard before, but what we've asked people to do is to talk to the manager who's on site at the location, but also to call our 2982 number, 240-777-2982 number.
Say it again, please. Say it again.
I'm gonna plug it into the chat. I'll plug it
Okay.
into the chat for you in just a second, but to call that number immediately and talk to the people who are there, to let them know what the situation is and to walk that through, so they can walk through and try to get a handle on what's going on with your situation.
Okay. Thank you.
Thank you. No more questions. We'll move to our.
Nope, I believe there's someone on the phone.
All right.
Yes, I wanted to know, what about for those of us who are outside and we want to get vaccinated? The libraries are closed, so those are the places that we usually go to get information, and you just hear things, but you don't know what's true. Are you all gonna ever have people, I don't know, like they used to have the mobile dental van that will come around, that will drive around to do the vaccinations? Because I never hear of things until it's after the fact, so what if those of us who are still outside, how do we get our vaccination?
Dr. Kroll?
Folks who are still outside, as in folks who are still outside, as in homeless outside?
Yes.
Yes,
there's of us in the woods.
In the woods.
Okay, I think we have been doing a little bit of outreach to the community, but I think we certainly should be doing more to let people know. We're certainly passing out flyers and information. I think that our colleagues here in Interfaith Works are probably good resources to let you know where you can go get vaccinated and when. And as we do more vaccinations, we're also vaccinating in and around the shelters and making our rounds through the shelters. So I think that we can certainly talk with our colleagues about opportunities to get you all vaccinated, and hopefully give you an opportunity to take advantage of some of the other services that might be available to you.
Mm-hmm. And you can also call, the Up County Hub. We actually have a list right now that we've been working of homeless folks in the Up County area. I don't know which area you reside in, but we were able to convince them. And they said, when you get Johnson & Johnson, call me, because they really want to do the Johnson & Johnson because they're afraid of the side effects. And since they're homeless, they're like, what if I get side effects and I don't have a place to stay? I don't have a place to sleep, which, they're very legitimate concerns with this population. So, but we were able to convince them. So now we're eagerly waiting for vaccines. We have about 7 of them. So if you call the Up County Hub, which is 240-912-1077, we'll be also happy to connect you and also connect you with a couple of the social workers that we work with at Every Mind.
We're also working, just to know you, we're shifting our locations around a little bit. And one of the things we're going to do, and I think over the next few weeks, is reopen our location down in Silver Spring at the Civic Center. Mm-hmm. And as we do that, we will work with the community, outreach community, and the folks at Progress Place and Interfaith Works to let you know that we're available and that you can stop by and get a vaccine. I'm also hopeful that Johnson & Johnson will be showing back up again in our supply
keep our fingers crossed.
In a lot more quantity than we saw the first time around, so that we can give you one shot and you can be on your way and not have to worry about coming back 4 weeks later.
And one of the things that Dr. Crowell mentioned briefly, but it's very important, is this homebound vaccinations that we were able to do with some of our families with the hub, especially with our folks over 70 and some of our folks who are over 65 but have no transportation, but they're very high risk, like dialysis or other severe illnesses. If you tell us where you are, we can actually help you get somebody to go to you to be able to vaccinate you. Because we know that this is a very vulnerable population, especially folks who are homeless. And it just breaks my heart when you know, the other day I was missing one of our clients, and he happened that he was actually at the hospital with COVID. And then he ended up in a hotel. And the saddest comment that I heard this year was, but Miss G, I was giving food 3 times a day and I had a place to sleep. But he had to get COVID. That is such a sad statement. And, you know, that's not really who we are in this county. So we can do anything to prevent folks from, you know, from ending up in that situation. I think that, you know, we're doing our job. We can sleep well at night.
Yes, and let me just echo one thing. Thank you so much for trusting us with your question and answers. And we do want to make sure that you and anyone in your community, could be family members, friends, is vaccinated. So please call those numbers. And if you are okay with it, you can certainly put some information in the chat box or call my number at 301-315-1105 at Interfaith Works. And as Grace said, give us your information so that we can try to make sure that someone gets to you. I hope you'll do that for us, please. Thank you so much again for sharing that with us. We really appreciate it. You know, this has been such wonderful conversation. We need another hour, but we thank you for hanging in with us this long. Courtney, our CEO, wants to, I know, share a few comments with you all about our advocacy campaign.
Wonderful. Thank you, everyone, again. And thanks for sticking with us. We intended to end at 8:15, but sometimes the information is so good, you just have to keep going. I did want to just mention in response to the question that at Interfaith Works, we have successfully coordinated with HHS, so Dr. Crowell's team, and with Shepherd's Table at our Progress Place location. And we held a vaccination clinic specifically intended for those who were experiencing homelessness a couple of weeks ago, and it was very successful. So I do know that there is an intent to do more of that. We have a meeting planned, I believe, for next week to talk through what the process will look like. But for the person who asked the question, the intent is to increase those opportunities. And I think that's also a very good segue into what I wanted to mention this evening. So at IW, we have historically been known as advocates for those who are experiencing poverty, advocates for those, obviously, who are experiencing homelessness as well. And we were very pleased to hear that Governor Hogan finally gave his consent to allow for a mass vaccination clinic to come to Montgomery County. It's not here yet. And to echo what Dr. Crowell said, there is some vaccine here and more is on the way, but we are not at that point yet. So my understanding is that April 5th is when the state-run vaccine site will be stood up. However, at this very moment, people who are looking for a mass vaccination clinic have to travel about 30 miles outside of Montgomery County to get to Six Flags. That's ridiculous, and I think we all agree with that. Even once the mass vaccination clinic comes to Montgomery County, we know that this is still largely a state-run effort. And there's no guarantee that despite Dr. Crowell's intent as the leader of HHS, and I'd say fantastic intent, and you've been doing a great job there, Dr. Crowell. If the state office or the governor and his office are holding most of the cards about how the vaccine is being distributed, then the inequity doesn't just go away because we have a mass vaccination site here in Montgomery County. And that really is the lens through which Interfaith Works is looking at this. It's fantastic that we have a mass vaccination site, but now we need to redouble our efforts around equity. Right now, as of today, according to Montgomery County HHS's data, white people who are 43% of the population, 49% of the shots have gone to them. Black people who are 19% of the population, 12% of the shots have gone to them. Latino people who are 20% of the population, 10% of the shots have gone to them. And we are really pleased to see that the number of vaccines that have gone to folks in the Asian community has increased significantly, because at the beginning, and we've been tracking this for several weeks, in the beginning, the Asian American community was also very disproportionately under-vaccinated. So we're happy to see that data has increased. It's about even for, at least for what's been projected about the Asian American proportion to the population. But we have a problem. We have a big problem. And we need to make sure that the governor is thinking, and the acting Secretary of Health is thinking about this all the time, that this is the constant sort of refrain that is coming from people who are constituents, those of us who in our private lives have the privilege of being able to, I think the phrase is cause good trouble, right? And make sure that there's a clear understanding that this must change. I think it was said earlier that if we continue to see these inequities, then the herd immunity that we're looking for will not happen. So that's sort of my intro to our advocacy campaign. The link to the letter that we are encouraging people to click is in the chat. So if you could please click on that, make sure you at least copy that into your browser before you leave this evening. We'll also send it out following this session to make sure that everyone has a chance. But we've made it really easy. We've written the letter for you. All we need you to do is click on the link, put in your information, which often is going to be auto-filled, and then click take action. And then you can send a letter to Governor Hogan. You can send a letter to Acting Secretary Schrader, letting them know that this is urgent for you. The more people who make sure that the governor and Acting Secretary Schrader are aware of these concerns, the more it's likely that they will listen and hopefully change course. So I'd encourage each and every one of you who are on this call this evening to take the time and make 2 clicks. That's all, actually maybe 3. So we've added an extra click. We need you to click on the link. We need you to click to autofill your information, and then we need you to click to take action. You can have sent your advocacy letter in less than 5 minutes. So if you could please take an opportunity to do that now, make sure that you have copied the link. And as I've mentioned, for sure, we will make sure that that information gets out to each of you via email following this session. And I will pause there because we have already extended our time, and we have doubly extended our time, and we surely want to at least be able to end by 8:30. But if there are any questions, we can take them now. Thank you.
I do have a question. Yeah, this is Chuck Williams. I'm curious, I had my first vaccination shot today at a Walgreens pharmacy, not too far from my home. Are we coordinating? I hear the need for mass vaccination centers, but are we coordinating with the pharmacies and other places that are spread out across the county in order to get folks in there for vaccinations?
Dr. Cole.
Chuck, I wish I could say absolutely yes, but the truth is absolutely not. Not in any kind of significant way. We are the state created these separate channels of where vaccines were going and created a whole separate network with Walgreens, Safeways, Giants, CVS's to do vaccination in the communities. And initially they were, as you saw, first come, first serve. I believe they probably still are in that vein, except you can pre-register for it, so you can schedule an appointment. Yes. and not have to chase a vaccine dose, which is a step in the right direction. I also know that they were required to devote at least 50% of their doses to highly impacted communities. So I'm hoping that those two things are happening. There's no way for us to coordinate right now. We're working to try to reach out to them to say, if you're going into communities, let's work with us so we can get you into communities. And I know there has been some of that going on in some senior independent living spaces and in a couple of communities. So we're actively working with them to increase that. But right now, if you got your first dose there, your second dose is there as well.
And unfortunately, I'm just going to add very quickly to it, is that we were having issues with reports that some of these Giant and CVS were asking for immigration status. And that has really spooked a lot of folks in the immigrant community because we have mixed families. So that's been an issue, unfortunately.
Our hope is we can solve that. I mean, both that immigration issue, but also access in the community with the drugstore going forward.
I would not be
that's a hard one. Oh, yeah. I'm sorry. Go ahead.
No, thank you for the question, and Dr. Crow for your answer. As we wrap up, I would not be a responsible CEO if I didn't take the time to plug our Interfaith Works Caring Breakfast. This is an event. This is our largest event that we have every year. This year it will be virtual. It will be fantastic, and I'm not just saying that because. Well, maybe I am a little partial, but it's going to be wonderful. The emphasis will be on networking. This will not be just another Zoom event, I guarantee you. The link for that is in the chat or will be in the chat shortly. Matt will put it in there, and we encourage you to sign up to register and attend and come and sort of celebrate with us and receive a wonderful message about all of the very important work that we've done during this pandemic. Thank you.
So with that, this has been a wonderful virtual conversation, and we want to let you know that we have been doing these on the monthly since the pandemic began. And our first one was in April, and we're anticipating having another one the last Thursday in April, which will be our 1 year of doing these. So we hope to see you there for that one as well. So we hope that we've answered most of your questions. It's been very informative. And so we're going to conclude, unless there's one burning question, that it's safe to conclude. Thank you, everyone. Thank you so much for your time this evening. Have a wonderful rest of the evening. We'll see you next time.
Thank you all.
Thank you. Good night.
Safe, everybody. Stay safe.
Thank you.